Hello everyone, my name is Dr. Joel Rosen. I am an adrenal fatigue recovery ninja, and today I want to talk to you about women that are suffering with a thyroid problem and how that relates to their MTHFR. And so what I've done is I've drawn a couple of boxes in areas where thyroid can be impactful. So what I want to tell you is that when you've been told you have an MTHFR problem, that's right here. And that could either be a plus plus or a plus minus, and that's considered heterozygous or homozygous MTHFR. And as a result, you won't be able to make something called methylfolate. And if you don't make methylfolate, as a result of that, you're not going to be able to produce energy. You're not going to be able to detox. You're not going to be able to turn off an infection. So more than likely you can express an autoimmunity like Hashimoto's because you're not producing methylfolate effectively. And when you don't produce methylfolate effectively, that impacts your ability to make other things effectively, because methylfolate is kind of like the ingredients that you have to bake in order to use those next ingredients for something else. But where does thyroid come in? So it's not only a problem when we have an MTHFR, in that your genes don't work at optimal efficiencies, but there's also other things that cause genes to not work at optimal efficiency, even if you don't have the methylfolate problem. And that could be the fact that you have a hypothyroid problem. So if you have a hypothyroid problem, what's happening is your thyroid is not activating B2 or something called riboflavin or something called FAD. So that's where you become a double whammy, where if you have a low thyroid function, your thyroid T4 activity will help activate riboflavin, and that will be used as a cofactor for your body to make methylfolate. So you can see how you can have a double whammy, where if you have a methylfolate problem, heterozygous or homozygous, and you have an underactive thyroid, then you have a double whammy. Not only do you have a reduced capacity for an enzyme to work, but you also have the cofactors missing that makes that enzyme work better. But here's the kicker. What came first, the chicken or the egg? And I would tell you that it's a negative spiral. So for example, when we have stress, when we have inflammation, when we have a stressful life, when we have toxic exposures, when we have infections, what does that do? That creates a cell danger response in your body. So your body says, hey, let's slow down here our gas, our limited resources that would fire off the thyroid and make energy for weight loss and warming up the house. Let's not spend the raw materials on that, but let's spend it on just survival. So things like breathing and things like brain chemicals and digestion and heart rate and fighting an infection. It doesn't care about the thyroid. So what does it do? It slows down thyroid function. As a result, thyroid function slows down, T4 goes down. Now you don't have that cofactor that's used. But guess what happens? This person has a methylfolate problem too, and it creates a double whammy. And so what happens is now you're not producing a lot of methylfolate because that thyroid is also underactive. And it was underactive because your body is trying to conserve energy. So it becomes a negative spiral. And as it becomes underactive and produces less thyroid hormone and less activation of riboflavin, then you're producing even less methylfolate because your body has to conserve energy. So it becomes worse and worse and worse and worse. There's other areas that I'm not going to talk about on this video that require activated riboflavin as well. So this would be the next ingredient. So now you're going to have a double whammy, or being able to detoxify, or being able to make neurotransmitters, all because of an underactive thyroid. So anyways, I hope you got a lot of value out of this video. I do consults all the time, troubleshoot with patients across the country, go over your thyroid hormone, go over other enzymes that you may be dealing with, other genetic components, other epigenetic components, all to customize a program around your problem. So anyways, my name is Dr. Joel Rosen. I hope you got a lot out of this edition of Adrenal Fix. Make sure you like my YouTube channel. You give me a thumbs up, a share, a like, a comment. Check me out on Facebook at Adrenal Fatigue Recovery, or check out my blog at adrenalfatiguesociety.com. Thank you so much.